Minister, thank you very much for agreeing to this interview. Can I ask you to formally introduce yourself, please?
Yes, thank you. My name is Mohammad Ali Pate. I'm the Coordinating Minister of Health and Social Welfare in the Federal Government of Nigeria.
Minister, what do you think are the major challenges of antimicrobial resistance for Nigeria?
There are a few challenges. First of which is knowing the extent of antimicrobial resistance in our population, in our facilities, in human health space, but also in the animal health space. The extent to which it is a major issue, I think we can extrapolate based on sentinel data, but I think there's a limit. I think there's an underappreciation of the extent to which it is a problem in terms of contribution to morbidity, mortality, but also productivity even in animal health. Secondly, the surveillance infrastructure that we have, I think, has improved, but it's not yet near enough to give us full visibility of the extent of the problem. The capabilities of our laboratories, the infrastructure to test, to have the sensitivity tests and to identify the pathogens and the patterns that exist, I think is also an area that I think we're struggling to improve. The capabilities of the personnel themselves, I think, is an area that we'll have to improve. Broadly, from a governance perspective, we've taken a few steps, but I think we need to, given the complexity of our federal system, though we have a One Health Steering Committee that we've launched, which has met already a couple of times, and various mechanisms, the coordinating mechanism across sectors, and the technical working group, we need to make them functional, not only at the federal government level, but also at the subnational level. And the popular awareness of the issue of antimicrobial resistance is yet to be very widespread. Those are areas that we're working on to address.
Do you think in Nigeria some of those areas are stronger than others? Are there some that you're sort of more focusing on at the moment?
I think on the governance side, we've done something that is good, setting the stage across sectors. In the animal health space, I think there's a lot more deficit in terms of the surveillance systems, the infrastructure, the human capability, the field epidemiology in the animal health arena. In the human health side, I think over the years we've had investments in that area. And through our Center for Disease Control, through the various teaching hospitals that we have, I think we are fairly strong in that, even though it's not let's say to the level that say we'll say we've covered that, but I think we're fairly strong on that. The population awareness, I think there's a lot more deficit in terms of understanding misuse of antibiotics or not properly using antibiotics for anything febrile, for instance, or not complying to the full course of antibiotic and full resistance. I think that's an area that we have to do a lot more.
You've articulated the problems very well, and you've alluded to maybe some of the potentially some of the solutions, but overall, how do you think some of these problems can be tackled in Nigeria?
Putting the resources domestically within the limited fiscal space that our governments have, both at federal government but also state level, we need to expand the resources available so that the infrastructure in our laboratories, the human capacity can be enhanced. That's one way to do it. And the step before then, which is organizing ourselves, I think we've done it at the federal government level, but I think the subnational level need to operationalize those mechanisms as well across sectors. We did approve in the National Council on Health, gave the mandate for the subnational units to act in a cross-sectoral way around the One Health agenda, so that both human and animal health and environmental sectors are conversing, not only in terms of other things like pandemic preparedness, but also in terms of antimicrobial resistance specifically. The National Action Plan for antimicrobial, for dealing with antimicrobial resistance, it's been updated. And of course, there will be resource implications for what we need to do to address it. And that will require increase in domestic resources to the health sector, in the animal sector and the environmental sector as well, and complemented by developmental financing over time. So it's a very important issue for us, and we have to deploy the resources within the limits of what we have to address those.
Again, you sort of alluded a little bit to some of the potential hurdles. Overall, what do you think are the barriers for Nigeria in reaching those solutions?
The barriers derive from some of these challenges that we spend $13 per person on health. That's a very limited public finance available for health overall. So the choices to be made within that, whether it's provide vaccination, human resources for health, and all of that, is limited. And that we're working to expand that, in addition to the private spending, which is unfortunate, but it's high out-of-pocket spending from our population. So addressing that, the functionality of our health system more broadly, is something that we're working at it. And I think that's a key constraint. But the urgency with which we have to address antimicrobial resistance specifically, I think far exceeds the level of investments that we're currently making. So when you look at the laboratory infrastructure for microbiological cultures and sensitivity being widespread for us to know the scope of the problem, the specialized human resource capabilities that are needed to track and to understand the patterns and to be able to respond with appropriate guidelines for practitioners to be able to use them. The necessity of the health, the animal health space also understanding their actions, because AMR is one that is, in a way, requires the human health, the animal health, all working aggressively to not only in terms of the drivers of antimicrobial resistance, which is mostly in the animal health and agricultural space, also the environmental space, water and sanitation, and its impact on fueling antimicrobial resistance, and then on the human health. On the other side, the recognition is not as much as in the primarily human health space. And I think the mechanism we have put together through the One Health Steering Committee is beginning to address that, and we hope to replicate that at the subnational level as well. Because it's not only the federal government, we're a very large country with 36 state governments. And so what we do at the federal government in certain direction, we also have to, it takes us a lot longer to actually ensure that it's enshrined, understood, adapted by the subnational units as well, so that we move as a country. Yeah.
That's excellent. Thank you, Minister. You know that in September we have a high-level meeting, UN high-level meeting on antimicrobial resistance. What would you like to see come out of that meeting for Nigeria?
I think it's important that the global community really looks at this from the point of view of the global commons. That what happens if we don't have full visibility of the patterns of antimicrobial resistance in Nigeria, it can find its way in the global capitals, in other countries. And that having an investment framework that allows countries who may be differently abled to finance those investments that are necessary to draw the resources to complement domestic financing will be key. The knowledge that will be generated as a result of global cooperation should be made widespread so that we learn what other countries at similar levels as we are doing, or learning from how they are responding to the AMR would be very valuable by itself. And creating partnerships that are rooted in understanding of local context, of our own context, and helping us move in the right direction would also be a very good outcome. At the end of the day, it's one thing to have global conversation that just stays at the global level. The issues are in the front end, at the country level, and ensuring that whatever conversations are had at the UN high-level meeting really translate in actions at the country level, which is financial resources, human resources, partnerships that are adapted to the needs of the local context.
Thank you. You've more or less answered this question, but I think in terms of the specifics and the priorities, What message would you like to give to the United Nations in September? What would be your priorities coming from Nigeria? What would you like them to understand? What is coming from Nigeria?
Expand antimicrobial surveillance capacities across countries so that we have visibility, understand the burden, build the human resource capacities to understand the patterns and how it relates to what is going on at the country level. And that requires resources that will have to be provided, basically, to complement domestic financing that countries are putting themselves.
So things like access to diagnostics, I guess access to appropriate antibiotics, would be important. And I think from what you've been saying, also prevention, vaccines, but also prevention in terms of the spread of resistance throughout hospitals, presumably.
Yes, and research into new antimicrobials to deal with the issues, because we know that we're playing catch up as well. While we're improving how we use existing antibiotics and preventing new emergence of other of resistance in the pathogens that we have, also be ahead of the game, because I think there's a limit to how much we can actually blow through the existing antimicrobials over time. So there's a global commons agenda there in terms of fostering research to identify new ways of dealing with antimicrobial resistance.
One of the things that we find working with our African colleagues and friends is that diagnostics are still quite expensive and antibiotics are cheaper. And so therefore people will always kind of revert to giving antibiotics, not knowing anything about the microbiology, whether the bug is sensitive or resistant. So how important do you think it is for Africa and particularly Nigeria to have access to affordable diagnostics for critical infections? Is this a priority? Would this be a priority?
It's a very important priority. 40-50% of fevers may be malaria, but the rest are not malaria. And yet we have not only treatments for malaria, but also antibiotics being administered for things that may be actually viral in etiology. So having better diagnostics certainly will help limit or help us to make more rational use of the existing antibiotics. Now, in the case of Nigeria, we are working with some of our partners to see how we can, in fact, even domestically manufacture some of the diagnostics that may be more affordable, usable in our own context, and help us to make better use of antimicrobials for the treatment of fever, for instance. And there are many ways to disrupt the diagnostic space in a way that can make it more affordable. And I think that would also help in reducing the pressure of antimicrobial use, which drives some of the antimicrobial resistance that we're seeing.
Minister, you've answered all my questions in a most articulate and eloquent manner. Thank you very much for your time.
Thank you very much. Thank you.